I'd like to thank you for inviting me to speak today from the patient perspective, which is very important. We've heard from lots of esteemed medical professionals, but I am the patient who has been through BRCA testing, so I wanted to share my story with you. So I am what I affectionately call a mutant, a little bit like the X-Men, but while they have the power to turn into fire and ice or render themselves invisible, I have the power to develop cancer. My story started in 2002 when my Auntie Renee, my dad's sister, developed ovarian cancer. It's Auntie Renee on the left, and she subsequently developed endometrial cancer. She was BRCA tested because she developed ovarian cancer. Her mother had developed breast cancer in her 40s and died from the disease in her 50s. Various other aunts had also developed breast cancer, and we are of Ashkenazi Jewish descent. So whilst in the general population, between 1 in 400 and 800 people will carry a BRCA mutation, in the Ashkenazi Jewish population, 1 in 40 will carry a BRCA mutation. She was treated at the Royal Marsden Hospital, and they gave her her results, and that was it. She was on a mission to educate the family. So she bombarded us with letters and phone calls, trying to share this knowledge that she had gained. I ignored the knowledge because I had 3 small children, had never heard of BRCA mutations, so it went completely over my head. She was very persistent with trying to get us to go for testing. So eventually in 2006, I took a letter from the Royal Marsden Hospital to my GP. So it was a to whom it may concern letter, which detailed that Auntie Renee carried a BRCA mutation and would my GP please refer me to my local genetics centre. My GP read the letter. He asked me a little bit of information about my family history. I told him that various aunts had developed breast cancer. I didn't really know who they were because they died before I was born, and that Auntie Renee obviously was battling ovarian cancer and endometrial cancer. He read the letter. He said, "I've just been on a course about this," and I was so excited. I thought, fantastic, he'll know what he's talking about. He said to me, "I don't think you'll carry a mutation, so if I were you, I'd go home and stop worrying about it." So I did. I mean, who was I to question him? He was the GP, he'd studied medicine for however many years, and he'd just been on a course about it. So great, off I went, never thought about it again. In 2007, in June, Auntie Renee died, and 10 days later, I lost my beloved dad to lung cancer. It was a couple of weeks later that we got a phone call for my dad. My mum explained that he'd passed away, and this man identified himself as a genetic consultant from the North East Thames Genetics Service, and he explained that before my dad died, he'd been for BRCA testing, something he hadn't shared with us. He said that my dad had tested positive for a BRCA2 mutation, and he asked, did my dad have any children? So my mum said yes, 2 daughters from his previous marriage, and my sister and I from the current marriage. So he arranged for all 4 of us to go for testing. So my 2 half-sisters went together under one genetic service, and my sister and I went to the North East Thames Genetics Service. So our experience of BRCA testing, I feel, left a little bit to be desired. We went and we met with the genetic consultant who sat us down, and he said, so, if you test positive for a BRCA mutation, you are at risk of this cancer, that cancer, this other cancer, another cancer. He threw loads of numbers, percentages, statistics at us. And you can't take that in. You're sitting there and you don't understand what any of it means. You just hear cancer, 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 and you feel terrified. You feel vulnerable. You just sort of nod, smile. He said, would you like me to take your blood now? Well, yes, that's fine. It's a blood test. You think it's a blood test like any other blood test. So you give your little vial of blood and off you go. 6 weeks later, we were called back. And on the way in, we'd had a little discussion, and we said, so, we both need to be the same here. We both need the same outcome. So, it's either got to be both of us positive or both of us negative. So we sat down and we had the same conversation. So if you test positive for a BRCA mutation, you have an 87% lifetime risk of breast cancer and a 34% lifetime risk of ovarian cancer and this cancer and that cancer and blah, blah. And we just said yes. And he said, would you like your results? And we said, oh, okay, because, you know, it's only test results. He said, you both carry a BRCA2 mutation. Well, we both sat there and we went, yes, because we were the same, but he looked at us like we were mad. I don't think he'd had anybody as excited to find out that they had a BRCA2 mutation. It just meant that we could go through our journey together and we could support each other. So that, to us, was what was important. So we were then told, I was 33 at this point, my sister was 29, that there was no screening for us till we were 35, so goodbye. So off we went, again, with no support, nothing. The minute I hit 35, my mother was on the case. She was asking, you know, what are you going to do about this mutation? We still didn't really know what a BRCA mutation meant. There was nothing about it in the press, not like today where everything you read is about BRCA mutations or Angelina Jolie or other celebrities. So I went back to my genetic consultant and I said, you know, I'm 35 now, what do I need to do? So he referred me to Bart's Hospital in London, and I saw staff at the family history clinic who sat me down, went through my family history with me. And the thing with going through family history is, or in my case, was most of the people who had developed cancer had passed away. So I couldn't really give a very accurate family history, but I gave what I could. I was then sent for a mammogram screening and an MRI screening. And when the results came back, it showed shadows on both breasts. Now, that was terrifying because I was convinced I was going to die. It sounds very, very dramatic, but you know, suddenly you're seeing all these people and they're giving you, again, all these percentages, and you're going for all this testing and you're thrown into this world of cancer, 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 and you do, when you get a result like that, you think, my God, I'm going to die, that's it, I've got 3 small children, what's going to happen to me? So I was recalled for an ultrasound, and the few days that I had to wait for this test were the longest few days of my life. And it was at that point that I decided I couldn't live like this, I couldn't go like this from year to year, you know, waiting 6 months from an MRI to a mammogram and thinking that test is only as good as the day it's done because, you know, 3 weeks later, what is growing, what is trying to get me? So I made the decision at that point that as soon as this testing was over, I would opt for risk-reducing surgery. So I had the ultrasound and it showed that the shadows on my breasts were just from where I was in my menstrual cycle. So it was a huge sigh of relief, but it really compounded my thoughts that I couldn't live like this. So in November 2009, I had a risk-reducing bilateral mastectomy with immediate reconstruction with permanent expander implants. I remember smiling as I was wheeled down to the operating theatre, and as I woke up, I was so happy because I'd made the decision. It was all done on my terms. You know, I didn't want my breasts to try and get rid of me. I was going to get rid of them before they tried to wipe me out. So it was a huge, huge sense of relief. There was nothing in the UK at that time to support people with BRCA mutations. So doing a bit of Googling, I came across Bracker Umbrella, which was a website set up by another lady who had tested positive for a BRCA mutation. And I became obsessed. It was a place where people understood me and the fears that were going around my head. Because the minute you test positive for a mutation, especially a BRCA mutation or probably lots of other mutations, and you know you're at very high risk of developing something, but you actually have nothing wrong with you, you're terrified, you feel vulnerable, you know you're scared that that's going to be the end of you. So the people who I found on there understood me, they knew what I was going through, they could answer my questions. They'd been there, they'd done that, they knew the fear. So it really made a difference to me. In November or December 2013, after having my 4th child, I opted for more risk-reducing surgery and I had my ovaries and fallopian tubes removed. Now I feel like I'm a member of the all done club. I've got rid of all the bits that I can get rid of that are trying to get rid of me, and I feel very, very relieved. So I've been thinking about some tips for healthcare professionals based on my experience and those of the members of Bracker Umbrella, which I've come to take over. And this is what we came up with. Listen to your patients and take their concerns seriously. Because in my experience, my GP didn't take my concerns seriously and, decided he didn't think I'd have a mutation and disregarded even a letter saying there was one confirmed in my family. BRCA mutations are traditionally associated with increased risk of breast cancer and ovarian cancer, but they also put us at risk of pancreatic cancer, prostate cancer, and melanoma, amongst others. So please, if you're looking at family history, like Imran said, look for pancreatic cancer, prostate cancer, melanoma. Don't just look at breast and ovarian cancer, and look at men. People seem to think that the mutation can only come down the female side, and this is not true. I got my mutation from my dad, so the NICE guidelines are a very useful tool for referring women with a family history if the mutation is carried along the female line, but there will be gaps if it comes down the male line. So again, look at prostate cancer, male breast cancer. Those should be warning signs. Remember, patients will often have researched and can signpost you. We're living in an age of expert patients. If you join a support group, you will know things that maybe your general practitioner will not know. So please don't be offended if your patients try to tell you something that you don't know already. There are benefits and complications to getting genetic test results. You do feel greatly empowered by the knowledge, and it enables you to make informed decisions about your future and your future health. But this also infers complications. So you have issues surrounding fertility. Do you want to have children knowing that you carry a BRCA mutation? Do you feel that's the right thing to do? Lots of people have big issues with this. It's a very, very personal choice. So I have opted for the risk-reducing route, whereas my sister has opted for surveillance. So, in families, you have very different choices. And once the information is out there, you can't unlearn that information. Once you've got it, you're stuck with it. And it opens a whole can of worms. If you carry a mutation, then people in your family are going to worry, have I got that? Is it something I should worry about? So it's something that needs to come hand in hand with a lot of counselling. Lots of people are presented with information they don't understand. As patients, we don't understand the results of genetic testing, and we need, again, counselling. We need people to sit down with us and say, this is what this means for your family, and this is what you can do about it. Also, getting BRCA test results is the beginning of a journey. It doesn't mean, you've got the results, you're okay. It means you now know what your future may hold, and it opens up routes to either risk-reducing surgery, surveillance. So people, if you are looking after patients who have got a BRCA mutation, please sit down with them, spend the time to counsel them, to talk to them about what their options are, and don't leave them on their own, because it is a very, very frightening prospect. And I'd just like to dedicate this to my Auntie Rini and my dad, who gave me the gift of knowledge, which is the most precious gift I've been given. Thank you.